Welcome to Medicap's BDS Express short concept discussion. In today's class, we'll be discussing one of the very important topic of pharma, and that is routes of drug administration. So before starting, let me tell you, if you have not subscribed to our YouTube channel, please do subscribe it and press the bell icon so that whenever we post any new content, any new videos on short concept or on question or quiz discussion, you'll automatically get notified. Now, let's start the topic routes of drug administration. So this is the first chapter of your pharma, and you should know what all are the routes by which you can give any drug to your patient. So broadly, they are divided into systemic routes and local routes. So this is the broad classification. Now, when I say systemic, again, systemic, it is divided into enteral route and parenteral routes. Okay, so this is one and this is two. Now, enteral, we have three routes. First is the oral route. Oral route, you take medicine for fever, for headache, or you can say for even stomach ache. All these you take through oral route only. Now, oral route, we can give tablets, capsules, then syrups, all these we give through the oral route. Now let me tell you, if they ask the long note, then you are supposed to write each and everything related to routes of drug administration. If they are asking you any specific thing in short note, then you are supposed to write these things for your short note. Like say for example, they'll say write down the short note on oral routes of drug administration. So they are expecting what all you give through oral route. That means tablet, lozenges, tablet, capsules, syrups, and all those things. And also they'll say that what are the advantages and disadvantages of this route, or indications and contraindication of these route. Let me tell you, every route of drug administration, they have certain indications and contraindications. Like say suppose for oral route, this is the most commonly used route, but if the patient is, you can say, unconscious, or they are having this vomiting and all, you cannot use this oral route. At that time you are supposed to give the medicine through some other route, right? Then second is sublingual. By sublingual I mean that you are supposed to give the medication through the sublingual. Sublingual means below the tongue you are supposed to put the drug. So the most common drug which we give through sublingual route is GT, and that is glyceryl trinitrate. So it is given in cases of angina. Then third is rectal route. So suppositories, they are given through the rectal route. Then coming on to the parenteral route. So parenteral route, they could be inhalation. Parenteral means that you are not directly putting it in the blood, or you can say in your oral cavity. Instead, it is infusing, or you can say injection. Infusion or injection, they comes under this parenteral route. So inhalation, transdermal patches. So even OCPs, that is contraception, could be done through transdermal patches. In this transdermal patches, a patch is placed over the elbow, or the any you can say any other location as well, especially it is given on your arms. So this is transdermal patch. Then the last is injection. Now injection, again it is divided into four. This will deal later, that means in next slides only. Then comes this local route. So when I say local route, so local route, it could be topical. Topical in the form of creams, you can say, or ointments. You're supposed to put it on the skin, on nasal, this nasal thing, ocular or ear. That means the topical creams, you can say, or ointment. Then the deeper tissue like intrathecal or intraarticular injection. Then arterial tissues. Now coming on to that same thing again, injections. So in the parenteral route injections, there are four types. When there are four forms by which you can give injection, depending upon the need. So first is subcutaneous. Now let me tell you the basic difference between all these things. So subcutaneous, you are supposed to make an angle of 45 to 90 degree. That means if this is your tissue, then you are supposed to make an angle of 45 degrees. That means the needle and the skin should be like 45 to 90 degree. If it is given in such form, then we say that it is subcutaneous injection. Now intramuscular, your needle should be at 90 degrees. right? Your needle should be 90 degrees when you are giving injection to your patient, intramuscular. Then intradermal around 25 degrees, 20 to 25 degrees for intradermal injection. Then intravenous is 15 to 25 degrees, or you can say 15 to 30 degrees whenever you are giving any intravenous injection to your patient. So the important thing is this thing, the angulation for injection, and also you are supposed to tell advantages, disadvantages, indications and contraindications for every route. Like say for example, if your patient is unconscious, you cannot use oral route. If your patient is like normal, then at that time you can give oral routes. Then there is suppositories, then local, like say suppose if any you can say cut or wound is there, you are not supposed to give medicine for everything. At that time you are supposed to place the ointment or creams, and all those they come in the local route because you want the local effect. Now let me tell you one more thing, that we even provide updates to this groups. Now you can directly go to www.medicoapps.org/groups. We are directly posting updates in these groups. So if you're a first year student, we'll be providing first year updates, second year student will be providing second year updates, and so on. And interns will be providing mixed of topic, or you can say the content, whatever it is beneficial for you. So I just request that we have limited access for this groups. You can just go to this link, that is www.medicoapps.org/groups. And still, if you have not subscribed to our YouTube channel, please do subscribe it and press the bell icon or hit the bell icon, so that whenever we post any new videos, any new content, you'll automatically get notified. Hope you have liked the class. Thank you.